How do red blood cells affect your A1 degrees Celsius test? Have you ever wondered how your red blood cells play a role in your A1 degrees Celsius test? This test is essential for understanding diabetes and monitoring blood sugar levels. Let's break it down in simple terms. The A1 degrees Celsius test measures the percentage of hemoglobin in red blood cells that has glucose attached to it. This form of hemoglobin is known as glycated hemoglobin. Since red blood cells typically live for about 3 months, the A1 degrees Celsius test reflects your average blood sugar levels over the past 2 to 3 months. The more glucose in your blood, the higher the percentage of glycated hemoglobin, leading to a higher A1 degrees Celsius result. Now, red blood cells directly influence the A1 degrees Celsius test because the test relies on the amount of glucose bound to hemoglobin inside these cells. Several factors related to red blood cells can affect the accuracy of your A1 degrees Celsius result. First, consider the lifespan of red blood cells. If these cells live shorter than normal, there is less time for glucose to attach to hemoglobin. This can lead to falsely low A1 degrees Celsius levels. Conditions like hemolytic anemia or blood loss can shorten red blood cell lifespan. Next, let's talk about red blood cell count and disorders. An increase in red blood cell count can dilute glycated hemoglobin, resulting in lower A1 degrees Celsius values. On the other hand, a decrease in red blood cells or certain types of anemia can raise A1 degrees Celsius levels, even if blood sugar is not elevated. Another important factor is hemoglobin variants and disorders. Some abnormalities, like sickle cell disease, can affect how A1 degrees Celsius is measured, potentially causing inaccurate results. Additionally, red cell distribution width is a measure of variation in red blood cell size. Changes in this measurement may correlate with A1 degrees Celsius levels and could serve as another marker for blood sugar control. Because the A1 degrees Celsius test depends on the properties and lifespan of red blood cells, any condition affecting these cells can impact the results. Doctors take these factors into account when interpreting A1 degrees Celsius results, especially in individuals with anemia or other blood disorders. Understanding how red blood cells affect the A1 degrees Celsius test is important for managing diabetes. Regular A1 degrees Celsius testing, typically done twice a year or more often if treatment changes, helps assess blood sugar control and the risk of complications. However, if there are issues with red blood cells, alternative tests may be needed to get an accurate picture of glucose control. In summary, red blood cells are key players in the A1 degrees Celsius test. Variations in their lifespan, count, and characteristics can alter A1 degrees Celsius results. This is why these factors must be considered in diabetes care to accurately evaluate blood sugar control over time.